Hello and welcome to everyone who's tuning in. My name is Maurice Goodwin. I am a licensed speech-language pathologist specializing in voice function and physiology. For the entirety of my career, I've had the privilege of focusing in the area of voice and voice function. In this video, we're going to be talking all about vocal fold paralysis. A vocal fold paralysis is a condition where the muscles of one or both of your vocal folds are not working the way that they should. This can cause voice changes like a hoarseness or a breathiness in the sound, and can also lead to challenges with swallowing and breathing. Whether you or a loved one, someone you're caring for, is experiencing voice problems, or you're just curious about how the voice works, then this video is for you. We'll explore the basics of voice function and anatomy, what happens when things go wrong, and then what you can do to restore and improve your voice function. So we'll start at the beginning. The sound of your voice is created by the vibration of your vocal folds, which are sometimes called vocal cords. The vocal folds are located centrally here in the neck, inside what we call your larynx. You can actually feel your larynx if you were to set your hand on the outside of your neck. If you were to talk right now, maybe say 1, 2, 3, 4, 5, you can feel the vibration on the outside of your neck. That vibration is the result of your vocal cords coming together to vibrate. They open and close to make noise, and when they are in the closed position or posture, they vibrate together to make sound. In the simplest terms, a vocal fold paralysis is a condition that happens when the muscles in charge of helping your vocal folds open and close aren't working like they're supposed to. Now, because of the location of the vocal folds, it's often not just your voice that is impacted by the presence of a vocal fold paralysis. The same collection of muscles responsible for helping you create your voice are the same muscles responsible for helping you swallow and really helping you breathe. Imagine if one or both of those muscle groups could not come together and vibrate. This is what we would call a vocal fold paralysis or a vocal cord weakness. This type of weakness in the muscles can cause weakness in the voice, breathiness in the voice, increased voice fatigue, voice effort. Typically, what clients will say to us is that it feels as though they're putting in so much work and not quite getting the quality that they used to. The quality might sound something like this, where it's extremely breathy, and they've really lost the power in their voice. Sometimes the voice can sound like this, where the pitch is different from what it used to be or isn't quite where they expect it to be. What causes a vocal fold paralysis to happen? A vocal fold paralysis can be due to nerve damage, which can be caused in something like a surgery, specifically a surgery related to the thyroid, to the heart, or somewhere in the chest, maybe involving the lungs, because the nerves and muscles responsible for helping to support the voice sit so close to that area. Other causes can include viral infections, tumors, and even traumatic injuries to the head or the neck, impacting the nerves responsible for controlling the larynx. And then sometimes, which is really challenging, the cause is completely unknown, which is what we call an idiopathic vocal fold paralysis. Understanding the cause of a vocal fold paralysis is a key step in understanding the best and most effective treatment for the vocal fold paralysis. In our current healthcare system, that typically involves something like a laryngologist, and a laryngologist would be an ENT or an ear, nose, and throat doctor who has done specific or extra fellowship training in the voice and upper airway, or the larynx, laryngologist, and a speech-language pathologist who has also done specialized training in voice and upper airway function. Now, not every ENT is a laryngologist, and not every speech-language pathologist specializes in voice. What you or someone would be looking for is a team that does. Now, the gold standard for observing and diagnosing a voice disorder is to perform something called laryngoscopy. Laryngoscopy is a procedure that uses a scope to look at the muscles of your larynx, the muscles of your voice, to see how they are or are not working the way that they should. Sometimes that laryngoscopy will also involve something that we call stroboscopy, which helps us specifically look at the vibratory characteristics of your vocal fold, often having a big impact on the quality of your sound. It is not until we've confirmed or affirmed your symptoms and know that there's a vocal fold paralysis or vocal cord weakness that we can really start to make decisions about care. Now, decision making for voice problems can often be complex. It can be due to What does the provider or the healthcare professional feel most comfortable recommending? What makes the most sense for the client in terms of resources, distance from the clinic, their ability to have procedures done at any moment? There are so many different variables that go into play when deciding which direction is going to be the most helpful or most beneficial. There is no one right way to treat a voice problem, and there is no one right way to treat a vocal fold paralysis. Thankfully, we have data that demonstrate with certain types of intervention, we're able to get closer to maybe what the client or what you would desire from your voice. However, everyone is going to respond differently to different treatments. Due to this variability in success and response to treatment, it is paramount that a client collaborates alongside the voice care team to choose the best intervention for them. Together, along with the client, we'll take a look at what our options are. Once again, anything ranging from voice therapy and voice exercises, also called speech therapy, depending on where you go, surgical intervention with the physician, or sometimes a combination of both. Voice therapy, something that a speech-language pathologist would have experience in, can be a first-line treatment for something like vocal fold paralysis. While voice therapy alone cannot unparalyze a vocal fold, we don't have data to demonstrate that, voice therapy can help us maximize the function of the larynx and help strengthen some of the accessory muscles to make sure that we are getting the strongest output for what we have to work with. When voice therapy isn't enough or just isn't recommended, surgical options can also be available to the client. A common intervention with a physician would maybe be a medialization, whether that medialization is temporary or permanent. And this happens by either injecting the vocal fold with material, once again, could be shorter term or longer term, that helps support the weak side or the weak vocal fold, or depending on the timing of treatment, something more permanent like an implant that's placed from the outside of the larynx to support the weak vocal fold. Typically, the overall goal of surgical intervention is to improve the medialization or the closure of the vocal folds. This medialization of the vocal folds would help with voice quality, swallowing ability, and even breathing. The path to treating a vocal fold paralysis is a collaborative one, and it involves the opinions and desires of the client along with the expertise of the care team, often involving the physician and the speech pathologist. Vocal fold paralysis is a condition where one or both of the muscles responsible for bringing your vocal folds together are not working the way that they could. This inability to bring the vocal folds together can cause changes in the voice, changes in the swallowing, and changes in breathing. The cause of a vocal fold paralysis can be nerve damage, surgeries, infections, and sometimes we just don't know. Specialists who diagnose this problem use laryngoscopy to look at the muscles of the larynx in real time to determine the severity of the vocal fold paralysis. It's critical to remember that the symptoms, causes, and treatments for vocal fold paralysis are complex and varied. Seeking guidance and advice from a healthcare professional who specializes in voice function is going to be paramount to getting the best information and starting your journey towards the most effective treatment. If you found this video helpful, please consider subscribing to the channel where we're going to talk all about the voice and voice function. There's content here to help you discover more about your voice and more about the work of speech-language pathologists. If you have any questions or comments about things you'd like to see covered in the future, leave them in the comments below. Your feedback is not just welcome, it's needed to make this resource as helpful as possible. Thank you for watching. Look forward to seeing you again.